Living with pain is hard. Whether it's your back, shoulder, knee, nerve pain, or another part of your body, pain can make simple things like walking, sleeping, or playing with kids feel impossible. Maybe you've already tried a lot to fix it. You've seen doctors, taken pills, tried physical therapy, chiropractic, acupuncture, or even surgery. Or maybe you even had surgery and it didn't work. Maybe you just feel stuck. If that sounds like you, don't give up just yet. There's something new that could finally help. It's called regenerative therapy, and it includes treatments like EMTT and shockwave therapy and Stimpod. These are not scary or painful. In fact, they help your body heal itself without drugs or surgery. So let's break it down so you can see how it works. What is regenerative therapy? The word regenerative means to help something grow or heal again. Regenerative therapy helps your body fix itself in a natural way. It doesn't cover up the pain. It works on the real cause of the problem. 3 of the most exciting treatments are EMTT, shockwave therapy, and Stimpod, which is pulsed radio frequency. So, what is EMTT? EMTT stands for extracorporeal, meaning outside the body, magnetotransduction therapy. It's a big name, but here's what it means. EMTT uses magnetic waves to go deep into your body, right where the pain or the injury is. These waves wake up your cells and help them start healing again. It's safe, painless, and fast. You can stay fully clothed during the treatment. Most people say that it feels like a gentle tapping or pulsating sensation or nothing at all. EMTT is great for inflammation, arthritis, back pain, and bone injuries like fractures, as it helps them heal faster. It can also help after surgery, including if you have hardware. It helps speed recovery after sports injuries. So how does it work? Number 1, it's high frequency magnetic pulses. These EMTT devices generate pulse magnetic fields with frequencies up to 282 kilohertz and magnetic field strength of over 60 millitesla. They penetrate deep into tissues, 18 centimeters deep, without causing heat or tissue damage. Number 2, it creates cellular stimulation. So these fields induce electrical microcurrents inside the cells and tissues. Well, what does that do? That stimulates the cell membranes, the mitochondria, and the ion channels, especially for damaged or inflamed cells. Hang with me. I know we're getting into biology and science, okay? So the mechanisms of EMTT, number 1, it restores the cellular membrane potential of injured or inflamed cells. Those cells have a reduced membrane potential, so they're less negative, and EMTT helps normalize that electrical potential, and then the ion change can happen. Sodium, potassium, calcium, that helps with nutrient uptake and cell communication. So very important. Number 2, it stimulates ATP production, enhances the mitochondrial activity, leading to more energy production. So this boosts the cellular repair processes. I don't know about you, but bottom line, I would love for my injuries to heal faster. So that's why. Number 3, it reduces inflammation. So it modulates the cytokine activity. Do you remember during COVID, they talked about the cytokine storm, and those that had a cytokine storm had more trouble and the airways basically closed due to all that inflammation? So EMTT, it does lower pro-inflammatory markers. I'm not going to name all of them. And it controls that cytokine response. So this leads for you less pain, reduction, and faster healing. Number 4, it promotes tissue regeneration. So it stimulates the fibroblasts to make fibrogen, osteoblasts for bone, stem cells, and other healing cells. So it enhances that collagen synthesis needed for tendon, ligament, muscle recovery, bone remodeling by stimulating the osteoblastgenesis, and it upregulates genes involved in bone formation, and angiogenesis, which is new blood vessel formation. So I want to share with you a great study that really shows how EMTT can increase healing times. The case study was published in the Medical Journal of Case Reports in 2024. A 24-year-old athlete with a clavicular fracture returned to competitive activity, completing a half Ironman triathlon 3 weeks post-injury and after receiving EMTT and surgery, compared to the typical 13-week recovery period. 3 weeks versus 13 weeks is an amazing difference. And competing at that level would normally be completely out of reach after a clavicular fracture requiring surgery and hardware. Amazing. So EMTT is showing great success with those who suffer from bone tendon issues at growth plates, like in teenagers. Those with what's called Osgood-Schlatter's disease, it's that growth plate right at the knee, are finding themselves returning to sport and competitive play at 6 weeks after the 4 weeks of EMTT treatment, when normally they don't have options. They're just told to rest. And sometimes this can be 3 months or longer. And it is evident on x-ray that that growth plate is no longer irritated and the player no longer complains of pain. These examples are just a few that explain why you are hearing of professional athletes and athletes using this technology. And now I want to bring it into the clinic to use it for the everyday person. I am one of 2 providers in Washington State that has the EMTT device in the clinic. In Germany and Europe, they are already using this device on a regular basis in many orthopedic surgeon clinics. One orthopedic trauma surgeon has all of his post-op patients using EMTT daily while in the hospital, especially after total knees and total hips. It helps that bone integration go better. The metal used in surgery these days is safe for MRI, so it's also safe for EMTT. Now let's talk about shockwave therapy. What is shockwave therapy? Shockwave therapy is another tool that helps your body heal naturally. It sends sound waves, not electrical shocks, into the area that is hurting. These waves improve blood flow and break up tight or damaged tissue, and that helps reduce pain and jumpstart healing. Shockwave therapy is often used for tendon problems. Lots of research on that. Plantar fasciitis, tennis elbow, rotator cuff pain in the shoulder. Shockwave creates a cascade of basically mechanical and biological responses that promote tissue regeneration and healing. So how does shockwave work? Again, I hope I don't lose you in some of this. Stay with me. Mechanotransduction. So it delivers mechanical pressure waves that distort the cells and the extracellular matrix. And these mechanical stimuli are then converted into biochemical signals inside the cell. Results in gene expression changes that promote healing. So you'll see upregulation of factors that promote blood vessels, right? That's just one of them. So secondly, it causes neovascularization. So that stimulates what I'm talking about a little bit of angiogenic factors like vascular endothelial growth factor. Just means it grows blood supply, leads to capillary formation, especially important in poorly vascularized tissues like tendons. Tendons don't get good blood supply. So better blood flow means better oxygen and nutrient delivery, which means enhanced healing. That's what you need to remember. Thirdly, stem cell activation and recruitment. So shock waves stimulate resident stem cells. That's amazing. That's what we want. That enhances the tissue regeneration by promoting cell differentiation and proliferation. So just know that stem cells, you know about that. You've heard it helps heal. Fourthly, pain modulation. It causes substance P to go down and less pain signaling, alters the function of the nociceptors and pain ending. So it resets chronic pain loops. Okay, number 5, collagen remodeling. It stimulates the fibroblasts to produce type 1 collagen, which you need for healing of tendons, right? Breaks down disorganized scar tissue or fibrosis, and it restores the structural integrity of injured tissue. Okay? Going through fast. Number 6, anti-inflammatory effects. Downregulates the pro-inflammatory. Remember the cytokines? So that also happens with shockwave. Shockwave has shown great results with tendon problems like plantar fasciitis, Achilles tendonitis, shoulder tendonitis. Athletes are often subject to overuse situations, just the demand. So professional athletes and organizations like the NFL are using Shockwave to help their players return to play faster. Shockwave has an 82% success rate and a 50% faster return to player function. So you can see why people are turning towards Shockwave. The last regenerative option I'm going to cover is called Stimpod. I've talked about this before on a prior episode, but it's worth revisiting since we're talking about regenerative therapies. So what is Stimpod? It is pulsed radiofrequency for nerve pain and nerve regeneration and nerve healing. Pulse radiofrequency is minimally invasive treatment. It's now available in the outpatient clinic, and it's used to manage chronic nerve pain and neuropathy. Unlike traditional continuous radiofrequency, which ablates or destroys nerve and is a surgical procedure, pulse radiofrequency delivers short bursts of energy without causing thermal damage, allowing it to modulate the nerve function without harming the nerve itself. So here's how it helps with nerve regeneration and neuropathy. The mechanism is the pulse radiofrequency, like I said, and that causes an electrical field, right? Not heat. And it uses short, high voltage bursts of electrical energy, well below the temperature that causes tissue destruction. And then those electrical fields created by the pulse radiofrequency alter gene expression and cell signaling within the nerve. It also reduces inflammatory markers like the cytokines. You're going to get used to that word. This helps reduce the neuroinflammation, which is often the root cause of neuropathic pain. It's the inflammation around the nerve. And then it restores normal function of the nerve by normalizing those ion channels and the nociceptives, the pain-sensing nerves, which are often overactive. So it helps downregulate abnormal pain signals. And this is done through the suppression of ectopic discharges and central sensitization. So a lot of science there that I'm not going to dive into. It promotes nerve repair in animal and cell studies, and it enhances axonal regeneration, Schwann cell activity, which is very important for nerve insulation and repair, and neurotrophic factors, which support neuron survival and nerve growth. So got a little bit into some of the science there because I know some people like to know about it. But it's very promising. Pulse radiofrequency has been treating peripheral neuropathy, radiculopathy from like a herniated disc, and then also complex regional pain syndrome, which is often referred to as just CRPS, trigeminal neuralgia. There's been lots of studies where pulse radiofrequency was applied to the dorsal root ganglia for peripheral nerves, which help reduce pain intensity and improve nerve conduction and better functional outcomes overall. So it's definitely something to investigate if you have nerve symptoms. Now, why haven't you heard about all of these options, EMTT, shockwave, and pulse radiofrequency? It could just be that it's more prevalent and common in Europe than in the United States in our medical system. And something to remind you, in the US, big pharma and surgeries generate a lot of the income in the medical system here. However, that said, more and more pain specialists, physical therapists, sports medicine doctors are starting to use these regenerative therapies because they are seeing real results. If you follow any professional teams and professional athletes, you will start to see posts on their social media platforms if they were injured and used these methods to return to play faster. These therapies are already popular in Europe and are now growing fast in the United States. So keep an eye out for it. Who can it help? If you've tried everything and you still hurt, regenerative therapy might be the missing piece. It can help people who've had chronic pain that won't go away and want to avoid surgery or another round of injections. You can't take the pain pills or you don't want to rely on them anymore. You're recovering from an injury or a surgery and you just want to heal faster. Most people with these options start to feel better in just a few treatments, and some feel relief after the very first one. Is it safe? Yes. EMTT, shockwave, and pulse radiofrequency are all FDA cleared, and they've been tested in many medical studies. They don't have the side effects that come with the medications and the downtime and invasiveness of surgery. And because they help your body heal itself, the results are often lasting much longer. There's less downtime, and many people can't afford long recoveries, like surgery recoveries that would keep them from working for a long period of time or from competitive play if they're an athlete. You know, what's the catch? There really isn't one, but there's some things you should know. You'll need to go to a clinic that offers these treatments like ours. If you're in our area, you may need 3 to 8 sessions for full results. So EMTT is usually twice a week for 4 weeks for 8 sessions. And Shockwave is usually 1 time a week for 6 weeks. Typically, we would decide if we needed more. The effects of doing both together seem to show even better results depending on what you have. Regenerative therapies are not covered by most insurance plans, but most people feel it's worth feeling better. And you will have to be patient. The body actually heals for another 60 to 90 days after the protocol ends. So that means after 4 to 6 weeks of treatment, you'll still be healing for another 2 to 3 months. So the final effect is not met until 2 months later. Don't be surprised if you only feel 60% better at week 6. Most people feel like 80%. So that 100% mark is a little bit further out there. You don't have to live in pain. If you're tired of trying things that don't work, it might be time to try something different. EMTT and shockwave therapy or pulse radio frequency could be the answer your body has been waiting for. They're not magic, although we sort of feel like it is. They just help your body do what it's supposed to, heal. If you've tried everything else, why not try something that helps your body fix the real problem? Penrose Physical Therapy in Lacey, Washington is one of 2 clinics in Washington State that has the EMTT as of right now, May of 2025. We are one of only 3 clinics in the Olympia Lacey that offers shockwave therapy. And we are one of the few providers in Washington State, I didn't have exact numbers, offering the Stimpod or pulse radio frequency in an outpatient setting in a non-invasive manner. We offer a free pain consult if you're unsure if you would benefit from these therapies. You can call us at 360-456-1444 for a free pain consult regarding these. We have a regenerative medicine seminar on Wednesday, June 4th at 6 p.m. at Penrose Physical Therapy in Lacey. If you missed it, then just book a free consult and get on our email list for our next seminar. Our email is info@penrosept.com. And lastly, I just want to say, I even had my own story with this. I had a meniscus injury that got agitated. I ran a little too far, right? So then the next day, my knee was swollen and I could not straighten my knee all the way. And so I started on the EMTT and the shockwave, and within 4 weeks, completely gone. Each week got better, of course. Even within the first treatment, the first week, I could straighten my knee and start walking again without a limp. But in 4 weeks, I'm back to starting a little bit of like just a gentle run walk, and my workouts have been occurring, but I did less load in the last 4 weeks. So it definitely is amazing to also use it for my own benefit. So happy to help. Penrose Physical Therapy.